So it's a respiratory virus similar to RSV, very similar to RSV. It just causes a little bit different symptoms and infects at different ages and a little different time of year compared to RSV. Well, we're seeing a big surge of cases with HMPV right now, and I think that's not surprising. We've seen that post-COVID pandemic with many other respiratory viruses as people go out and about with their usual activities, more contact with other people, less masking. So all these respiratory viruses are being transmitted more commonly. So it's very similar to RSV. So you get fever, cough, cold, runny nose. Sometimes this usually lasts a few days. It generally affects all children by the age of 5, so they all get it. Usually at a little bit older ages compared to RSV, so the peak age of hospitalization, for example, with RSV is about 2 to 3 months, but with HMPV it's 6 to 12 months. And it usually occurs a little later in the season, so RSV is usually early fall through mid-winter or so, and HMPV is usually more late fall to late winter. Mostly it's young children who are most at risk for having lower respiratory infections such as pneumonia or bronchiolitis, but anybody with underlying heart or lung disease, or if they've got weakened immune systems, it can cause more severe respiratory infection. If your child has a cough and runny nose and they're handling it well, if they're not having difficulty breathing, then no reason to go to the hospital. But if a child is a very young child, less than 2 months of age and with a fever, then you should call your healthcare provider. If there's any difficulty breathing, any breathing rapidly, or you see the ribs sticking out, or any sort of blueness around the lips, those are signs that a child might need a little extra help with their breathing. If you're around somebody who's coughing or sneezing, then those droplets can cause infection. So that's why respiratory etiquette and cough hygiene is so important. And then the other way that you can get that is by touching things that, that infectious secretions have contaminated. So if people touch an infected surface that somebody has coughed on, and then you touch your eyes, your nose, your mouth, then it can be transmitted that way. You know, there's no specific treatment that's generally recommended for the youngest children, using a bulb syringe to